As she had said, my name is Ariana Anderson. I'm with Station MD. I'm the marketing manager over here. Today, I'll just be sort of moderating, watching the chat. I'll hand everything over to the doctors pretty soon, but you'll see that there is no Q&A here. So please put your questions in the chat and we will address them at the end. We've planned to leave plenty of time for answering your questions. So with that, I'm going to hand it over to Dr. Stanislaus, your DMH Chief Medical Director. And then after she is finished addressing you all, we will have Dr. Devin Unadkat, who is the Chief Medical Officer here at Station MD. So Dr. Stanislaus, if you want to take it away.
Certainly. Good morning. My name is Dr. Angeline Stanislaus. I'm the Chief Medical Director for the Department of Mental Health. And thank you for attending this webinar to learn more about the Delta virus and the vaccination. And really, we are ready to answer any questions. The reason this was specifically asked, especially for the developmental disability community or the intellectual disability community, the caregivers and the providers, was because there has been multiple studies over the last several months, and especially published studies, the experiences from UK, what we have seen in Missouri and across the country, that individuals with developmental disabilities or intellectual disabilities are at higher risk for severe outcomes if they get contracted with COVID. And this is something we've seen time and time again. And so we thought this was a good time for us to address why now, what is going on now that is so different between what the way we had the COVID wave that we had in spring of 2020 and also in the winter of 2020. What is different now, and also why vaccinate? What does it do? So I think this is two important questions that we have to answer. And the first question is what's this Delta thing? What is this Delta variant we hear about all this time? Why should we be worried about it? The Delta variant is actually a COVID virus that actually the original virus did come from Wuhan in China, and then it has mutated multiple times. What does mutate mean? It keeps changing its protein structure in that spokey thing, the spike protein or the spokey thing that comes out of it. It keeps changing the protein structure and what does that do? It makes it more easy to attach into the human body and get attached to it. So it's really trying to maximize its way to get into the human body. And that is why the Delta variant is different. And we need to know. How do we know that we have Delta variant in Missouri? Currently, we have about 95% or more of the COVID virus that is present in Missouri is Delta. And this is much more than the rest of the country. We are ground zero when it comes to Delta. It started in the southwest region of the state, Springfield and Joplin, where the initial area, even in the entire country, that had the big surge of COVID. And it started it started the first week of July, and is still on the uphill, now spreading to the rest of the state. So how do we know it is Delta? By the important thing is we've done sequencing on samples collected, which is how the only way we know it's Delta. The other thing is that there is a group of scientists from MU, University of Missouri Columbia, who have been looking at the sewer shed. So what they do is they take the sewer shed and look for the virus and sequence them, and that gives an idea of what is the prevalent virus that is the variant that is present in the state. So those are the two reasons we know Delta is present quite significantly, or more than 95% in Missouri. So what is different about Delta? So one of the things, as I said, it has made all these changes in the spike protein, making it easier to enter the body. So the moment it enters the body, be it through the nose or through the mouth, that's the only way it can enter, or if we touch our hands and then touch our nose and our mouth, inside the mouth, that's the only way it can enter. It gets sucked into the body, and the moment it gets sucked into the nose and the mouth, it's able to attach to the specific the body receptors or the specific areas in the body, attaches, and then it multiplies. So how much does it multiply? this particular variant can multiply 1,000 times more than the previous one. That is how makes a Delta much more different. So it multiplies 1,000 times more in the body. So what does that mean? When we breathe out, a person who's infected with COVID, when they're breathing out, they are getting out that much more intense amount of virus from the nose and mouth into the air around them, which then means that individuals who inhale that air are going to get that into their body. So that is a reason this is different. The other thing is, if you remember, the original COVID that came out in spring of 2020, that COVID was only if you had one person who was infected with the virus, it gave it to 2.5 other individuals, 2 to 3 other individuals got it. This Delta is capable of giving to 8 other people. So one person with the infection, they walk into a crowd and they're not masked and they're not socially distanced, they can give it to 8 other individuals. So 8 other individuals get it. That's because of the increased viral load, meaning there was more virus in the air around them. The other thing that we are seeing is that individuals are getting infected quicker. Previously, it took them about 4 to 5 days for the original virus to kind of get infected and get them multiply to a point where they were able to transmit to other individuals. What we are seeing with Delta, especially within our facilities where we test very regularly and monitor very closely, is by day 2 to 3. By day 2 or 3 after getting the virus into one's body, it has multiplied fast enough that it is ready to transmit out to other individuals. So this is where, again, masking comes very, very handy. So if the person, even before they know they have the virus, they're already transmitting to other individuals. The other thing, what we are seeing is also that people are getting sick quicker. Usually it was by week 2, end of week 2 is when individuals would end up getting sicker and going to the hospital. We are seeing a lot of individuals getting sicker much, much, much quicker within the first week. Again, this is another reason why Delta, it affects fast. It makes them get sicker and make them hungry for oxygen much quicker, causing pneumonia very quickly. The other thing, this is the other important thing we are seeing compared to the previous 2 waves, is the individuals affected, the Missourians and affected by this virus, they're much younger. If you remember the last time, they were 65 and above nursing home individuals. This time around, we are seeing individuals as young as 30, in their 40s and 50s, and even people I know who I work with have been infected, and they're much, much, much younger. That is an important thing. And individuals with intellectual disability, even if they have a little bit of obesity, their any of the neurodevelopmental conditions that they have, they are prone to get sicker with this virus. And that is very critical. And that's one reason why we really thought this message has to get out quickly to the community that cares for individuals with intellectual disability. So it can cause, the other thing we are seeing, especially when we had in the Southwest region, the Springfield and the Joplin area, the hospitals, especially when you looked at the hospitals, the hospital beds in a big surge, and the same thing with ICU, they ran out of beds and had to move to Kansas City and St. Louis region. It was quite critical. We are finding that more than 97 to 98% of those who are ending up in the hospital sick enough to need oxygen and sick enough to need a ventilator are unvaccinated. Okay, so it is so important that individuals who are unvaccinated are getting much sicker with the Delta variant. So that is another reason why this is so critical that we talk about vaccination at this point. And I'm willing to take questions on this. Just send the questions to chat. And once the presentation from Station MD is over, then we will answer your questions. We have actually got the first half and the next 20 to 30 minutes put aside so we can answer your questions. Be honest, throw no question as it's a bad question, just throw it. Let's have an honest conversation about this. With that, I turn it over to Dr. Untitled to take it on.
Thank you, Dr. Stanislaus. Hi, everybody. My name is Dr. Devin Unadkat. I'm the Chief Medical Officer for Station MD, and I'm an emergency physician. I have been in practice for about 20 years, taking care of people that are acutely ill, and run a trauma center in the New York area. I am out of New Jersey, but over the past 6 to 7 years have been working to build a practice to take care of individuals with intellectual and developmental disabilities, and had started Station MD. We are a telehealth organization with 35 physicians that take care of people with disabilities in the acute setting. And we've partnered with the state of Missouri right before the pandemic hit in 2020. This is pre-pandemic to help take care of individuals with disabilities in their homes. And a month or two after starting, the pandemic hit, and we've been taking care of people with disabilities in the state of Missouri now ever since then, and have seen a large number of cases over the past, I would say, 6 weeks, between 4 to 6 weeks. The number of cases we're seeing is significantly increasing in our community and in our population. And when Dr. Stanislaus and the Department of Mental Health had reached out to see if we could talk about the vaccination, I was really happy to do so. When the vaccination started, in January of this year, I'd say actually it started at the, mid to end December of 2020. Myself and my colleagues did a little homework on the vaccination. And before I had personally decided to take the vaccine, I did take the vaccine. I was actually one of the first in my hospital to get the vaccine. I wanted to learn more about the vaccination, understand how it was developed, and answer a lot of questions for myself, my family members, my friends, and certainly so I can give the right information to my patients. And we put together a presentation for everybody. We presented it at that time, and now again we have a lot more information to share, and I'm happy to share it with you so I can show you the information I use to make the determination on whether or not I should get the vaccine. Um, so can we go to the next slide? Yep. So first, a little bit about vaccinations. What is a vaccine? So we should understand that a vaccine is not a treatment. It actually is a mechanism in which we can actually protect ourselves from getting serious complications and illnesses due to a particular a virus or bacteria, actually. It protects the body from the disease, and successfully, we've been implementing vaccines for over a century, from things like smallpox, polio, and eradicated these diseases. So we no longer see smallpox because there was a vaccine that prevented the spread of smallpox or the spread of polio. And now our children are no longer affected by these particular illnesses. So historically, we've used vaccines to combat illnesses over the past century. And historically, there are different types of vaccines that are out there. The four most common are live vaccines, deactivated pathogens with something called an adjuvant, which helps the vaccine work a little bit better, or a combination of these. Next slide. In the battle against COVID, the scientific community has developed something called the mRNA vaccine. Now, mRNA technology is basically technology and science used to help basically develop drugs that will essentially tell the body to make a specific type of protein. And that protein is what is used to form an immune response to the particular virus. So mRNA vaccines traditionally have not been used, mRNA technology traditionally has not been used in the vaccine world. COVID and the battle against COVID, mRNA was the first type of vaccine that was approved. The science has always been there about mRNA vaccines. And in fact, mRNA technology is used in some of the drugs that are used to help with diabetes and cancer and such, but hasn't really been used in the development of a vaccine until COVID came along. Next slide. So the way it works is basically mRNA vaccines instruct the cells to make a protein, a harmless protein that mimics the spike protein, that same spike protein that Dr. Santa Claus talked about that exists on the COVID virus. So it's not the virus, it's just a little protein that looks like the spike protein. And after that protein is made, your body then recognizes that as something that's foreign and builds an immune response. So it builds antibodies to help fight off this spike protein. Once that spike protein is created, the mRNA gets degraded within 24 to 48 hours, your body gets rid of it, but now your body remembers that there was such a thing as this spike protein that it came in contact with, which was harmless, but it built an immune response to it. So it's ready if in the future the body is exposed to a protein like this attached to the COVID vaccine, which is a real vaccine, if your body is exposed to it, it'll know how to fight it off. Next slide. The key safety points from the mRNA vaccine, number one, it does not expose you to the virus. If you remember, I said it only exposes you to the mRNA protein, which tells your body to make something that looks like the virus. So it's not really, you're not exposed to the virus at all. You will not test positive for the virus just because you got the vaccine, because you're not getting the vaccine. I'm sorry, you're not getting the virus. You're only getting the medicine. And it does not interfere with your DNA. If you remember, I spoke about mRNA, and this is where it gets really confusing for many people. mRNA is not DNA. So mRNA is very different, and it actually it does not interfere with your innate DNA that you're born with. DNA is within the nucleus of the cell. Without getting into too much technicalities, mRNA is outside of the nucleus of the cell. mRNA never goes inside of the nucleus, and it never causes any issues with the DNA itself. The letters are similar, but they're two different things. The other type of vaccine that was developed to help combat the COVID pandemic was a viral vector vaccine developed by Johnson & Johnson or Jensen. Basically, in this particular type of vaccine, the body is injected with another harmless virus. So this is it's a harmless deactivated virus that tells your body to make a specific protein. Again, it's that same COVID spike protein. Your body builds antibodies or immunity to that particular protein, and now your body knows how to fight off that specific protein that's found on the COVID virus, on the coronavirus. So if you were ever in the future exposed to that virus, your body will know how to fight it off. Next slide. Again, the same three key safety points about viral vector vaccines exist as they do with the mRNA vaccine. It does not expose you to coronavirus. So it is not coronavirus that you're being injected with. Therefore, you will not test positive for the virus just because you got the vaccine. And lastly, it does not interfere, again, with your DNA. It does not do those things. It's not designed to do it, and it doesn't do that. Next slide. So both of these vaccines, actually there's three vaccines, right? Two mRNA vaccines, the Pfizer vaccine, the Mrna Vaccine, and the J&J vaccine, the viral vector vaccine. All three of them went through the different phases in approval processes. You know, phase one is a small group, less than 100 people. They test the particular virus in a controlled setting. And when they see that there's no real reaction to these vaccines, they move to phase two, which is a larger group of people. Phase three, which is a very large group of people. They look and they monitor for any side effects, any negative effects from these vaccines. And once they reach a critical volume at phase three and they see that this is relatively safe, they start to give these vaccines to the general public. So, and that's exactly what happened. This is exactly what happens with every single medication that's on the market for approval to be given to the general public. The same three phases have occurred with all three of the vaccinations as they have occurred with all the other medications that are approved by the FDA. Now, phase four is ongoing monitoring, and you'll see that as we give it on. And that phase four continues for 10 to even up to 20 years. So we'll talk about it very shortly. Some of the effects that have been seen a little further out, and they continue to monitor those, report those, and if, of course, if anything severe is occurring in a large group of people, then it's possible that they can roll back the approval of this vaccine. But we have not seen that to date, and the vaccine has been out for over a year now and given to millions and millions of people. And we'll talk about that shortly. Next slide. So one of the questions I got, and I've asked this question as well, is, usually it takes years for a drug to be developed and approved. How did the vaccine get developed so quickly? A lot of people are suspect. They're like, oh, well, what happened here? How did it get available so quickly? Well, there are three major reasons for that. Number one, remember the mRNA and viral vector technology has existed for years, for decades actually. So it's not like somebody was inventing a new type of medicine or new type of technology. It already existed. We just took that technology and focused it on coronavirus. Secondly, funding. Funding is so important. You hear about Project Warp Speed. Well, that's what it was. So anytime a new drug is developed, to get the funding, to do the research, to get everybody together, to do all the right things, it takes years and years and years. But because the pandemic affected so many people throughout the world, a lot of money from governments, from private industry, from non-governmental organizations, all different types of organizations threw money in to get this developed really quickly, because this was our only way out of the pandemic. So because of that, there was money available, and there was a lot of money available to develop this. And usually financial is the main reason why it takes so long for some of these drugs to come out into the market. And lastly, and I can't stress this enough, it's the abundance of volunteers. So many people, everybody was affected. Every single person on this planet was affected by coronavirus. Not everybody's affected by diabetes. Not everybody has breast cancer. Not everybody has a certain ailment like multiple sclerosis or whatnot. So you don't generally have so many volunteers. In this particular case, we had a lot of volunteers. People were willing to volunteer for these studies so we could study these vaccines. So because the technology existed, because there was enough money to do this, and because there were enough people to test these vaccines on, the vaccine was able to be developed and available to the general public in such a quick fashion, which we've never seen before. So it's a monumentous task that was that was able to be done. It's quite remarkable, to be quite honest. Next slide. Yep. So then, what are some of the side effects? So the overwhelming majority of the effects you're going to see after getting the vaccine, and I did experience some of these minor effects after I personally got the vaccine. You'll see some arm pain and redness. You may have cold-like symptoms for a day or two, some general malaise and fatigue. Some people refer to them as side effects. I like to refer to them as expected effects, because this is really what the vaccine is meant for. It's expected that you feel a little tired, because that's how you know the vaccine is working, because your body is building up this immune response. Lastly, allergic reactions are found. Sometimes you get a local allergic reaction, like a small little rash. That's probably the most common thing you'll find at the site of the injection. But sometimes you'll get more serious systemic allergic reactions. It's also very rare, but minor. Usually doesn't. It definitely doesn't. These minor allergic reactions do not require hospitalization. They're treated with some Benadryl, and everything is fine. So those are the minor effects. There are some serious side effects that I do want to discuss and make sure everybody understands. The most common serious side effect is anaphylaxis. And when I say most common, it's quite rare, but it is of the rare ones, it is the more common one. So anaphylaxis is a severe allergic reaction. I'll talk about that shortly. Guillain-Barré syndrome, thrombosis, and myelin pericarditis are the four major serious side effects, but all of these are very rare. So let's go to the next slide, and I'll explain how rare they are. So you'll see some of the serious side effects. So first, to date, as of the beginning of August, and today, there are more doses delivered, but 346 million doses of the vaccine was administered in the United States. So a lot of doses. Okay, 346 million. Of this 346 million, anaphylaxis, which is a serious allergic reaction, life-threatening allergic reaction, occurred in about 2 to 5 people per million. So very rare, but it does occur. And that's why after you get the vaccine, they'll monitor you for 20 minutes. These anaphylactic reactions occur almost instantaneously. So that's why they monitor you at least for 20 minutes after getting the vaccine, both the first and second dose if you're getting the mRNA vaccines. So again, anaphylaxis, the most common of the serious, but still so rare, but it does exist. Guillain-Barré syndrome is something that was noted after the J&J vaccine. Again, very rare. Guillain-Barré is a neurologic disorder that's known to occur with other vaccines as well, but it's also known to occur with coronavirus and other viruses as well too. It is usually not life-threatening or disability generating. It's temporary, but it occurs so rare. You'll see with the J&J vaccine over 13 million doses and only 143 cases were reported. But that's how strict this is. So if any other medicine was 13 million doses of any other medicine were reported and only 143 cases were reported of a particular problem, it wouldn't even make any news because it's such a small amount. But because everybody's looking at this so closely, including the CDC and the FDA, these were reported and studied, of course. So I wanted to mention it. The second issue is thrombosis with thrombocytopenia syndrome. So basically it's clots forming the leg, lungs, brain. Again, another very rare situation that occurs with the J&J vaccine, basically 39 confirmed cases. Okay, so very small amount compared to the 13 million doses. But it's there, it exists, and you should know. Lastly, myo and pericarditis, which is an inflammation of the heart lining and the heart itself, was found in some of the mRNA drugs, vaccines, 716 reported cases of the 346 million. So again, such a small amount, but these are things that were reported. These are definitely reported in the news, so I wanted to just make sure you were aware of them. Again, none of these three things, and with such a low incidence, would prevent me from recommending the vaccine or taking the vaccine, and it certainly did not for me because I took the vaccine. Next slide. Some of the precautions you'll see here. If you've had an anaphylactic or a severe allergic reaction to the first dose of the mRNA vaccine, they recommend that you don't get the second dose. And if you've had a history of a severe allergic reaction to anything, the person administering the vaccine may monitor you for a little longer than someone who has not had a severe allergic reaction. But generally, anaphylactic reactions occur almost instantaneously. And lastly, with any vaccine, and certainly the coronavirus vaccine, there's long-term monitoring of long-term side effects. The VAERS program, whenever you get the vaccination, you'll be asked if you wanted to sign up for it. I certainly did. It's a text message that I got on my phone. Initially, it was almost every day for the first few days, and then it spread out over time, and I still get it. I got the vaccine over 8 months ago, and it asked me, how are you feeling, any side effects, and you can report anything. So this way the data is collected and shared with the scientific community. So there's continued long-term monitoring for any long-term side effects. Next slide. So why get the vaccine? So I think this is very important to understand. The vaccine is not going to prevent you from getting coronavirus. It's not going to do that. I'm not going to tell you any falsehood. You may get coronavirus. Just like if you get the flu vaccine, you may get the flu, right? But what it will prevent you from getting is very sick, becoming hospitalized, and dying. That is the benefit of getting the vaccine. See, we don't give meds so you don't get a runny nose. That's not why we do this. We give you these meds or vaccines so you don't get sick to the point where you die. And that's the big take-home message here. So fully vaccinated people may get breakthrough infections. And we know that that does happen, but those breakthrough infections are not going to get you sick enough that you need to be hospitalized and die from. That's why you should get the vaccine. That's why I got the vaccine. So some common myths I'll quickly go through these. Can receiving the COVID-19 vaccine cause me to become magnetic? Can I become Magneto, the superhero? No, yeah, you won't be. So don't think that that's going to happen, because there are no metals inside of the vaccine. The ingredients of the vaccine do not produce any electromagnetic fields, so you won't become magnetic after getting the vaccine. Sorry. Next. Do any of the COVID vaccines authorized for use in the United States shed or release any of their components? No, vaccine shedding is a term used to describe the release of the vaccine components in and outside of the body. Vaccine shedding can only occur when a vaccine contains a weakened version of the virus. None of the vaccines contain a weakened version of the virus, so you will not get any vaccine shedding. Next slide. Is it safe for me to get the COVID-19 vaccine if I'd like to have a baby one day? So the data is showing that yes, it is safe for you to get the vaccine. It has the vaccine does not affect your ability to get pregnant or to impregnate. So it does not affect male or female fertility. Next slide. Will a COVID vaccine alter my DNA? We've talked about this. It does not alter your DNA. The mRNA and viral vector vaccines just deliver messages to help build your immune response. It does not alter your DNA. Next slide. Will getting a COVID-19 vaccine cause me to test positive for COVID-19? And again, like I've said, it does not cause you to test positive. Neither, all three of them, none of them will cause you to test positive. If you do test positive after getting the vaccine, that's because you have a breakthrough infection. That means that you were exposed to the virus. It's not the vaccine itself that's causing you to be positive. Next slide. So in summary, the vaccines are safe. They're actually some of the safest drugs that are available on the market. No corners were cut in developing the vaccine. I feel that it's important to get the vaccine for many, many reasons, not just to protect yourself, to protect your loved ones, but also to protect the community. And in our particular situation, to protect the individuals that we care for as well. And lastly, even if you get the vaccine, even if after getting the vaccine, you still have to practice some mitigation techniques on masking, washing hands, and practicing some social distancing, because like I said, just having the vaccine doesn't prevent you from getting the virus. We have to continue to stop the spread of the virus. And as you've seen, in areas where vaccination rates are high, hospitalizations are low, and these types of social distancing and mitigation techniques are more and more relaxed. But when we start to see high volumes of cases, we have to start to go back to washing hands rigorously, practicing social distancing, and wearing masks. So I would recommend to continue doing that until the cases in the state of Missouri and in your local community start to come down. And then as the local community leaders start to relax some of these measures, we can hopefully at some point shortly get back to somewhat normal situations. Next slide. And I did get the vaccine, and there's a lot of new news about boosters and things like that, which we can answer shortly. So I don't want to take up any more of your time. Let's get to some questions and answers.
Alrighty, I'm going to go ahead and stop sharing. Let me take a look at the chat here. I know we saw some questions come in. Let's start with at the top. Back last summer, the mRNA manufacturers said that if new variants arose, they could quickly come up with new vaccines specifically to deal with it. Why aren't we hearing about new vaccines targeted at Delta?
Well, because we know that these current vaccines work against Delta. So there's no need to develop a new vaccine.
Next, we have what kind of documentation does a person need to present to acquire a booster shot? Do we know that information?
Today, I can take that. In Missouri, what I heard today was if you are you can just go to this, go to CVS pharmacy or wherever you got your vaccination first, and they can give you the third dose. And you just sign up, and they are able to give this third dose. At the present time, the recommendation is only for individuals who have an immunocompromised condition that makes the body's ability, that had made it difficult for the body to produce the full amount of antibodies required for protection. So for those who, for others, it's not recommended by CDC. And so right now, if you're one of, a family member, or you're caring for an individual with intellectual disability who also has immunocompromised conditions such as cancer, treatment for cancer, or have been autoimmune conditions and have been on medications that suppress one's immunity, then you could just go to call the pharmacy, local pharmacy, especially CVS or Walmart, and see if they will administer the third dose.
We took the antibody Mayo Clinic spike protein test a couple of months ago. One of us got the result of greater than 20,000 and one of us got 5. What do these numbers mean?
Okay. I can take that, Angelina. So I am part of a study myself where they're measuring my my spike protein antibodies every few months. And yes, it is very confusing when you get these results because we don't know what it means. So the reason why they're checking these antibodies is to see what will happen and at what level do they need to start to give these booster shots? We don't know what 20,000, 10,000, 5,000, or even 5 means. I can tell you that 5 is probably low, right? It's low enough where you're probably not protected, and 20,000 seems to be high enough. But that's just based on, it's high and low. So that's all we really know. We don't know actual true titers like you do with some other vaccines like hepatitis. They're like, oh, after it's below a certain titer level, then you're not protected. But when you're talking about those extremes, the person who's got 20,000 is probably more protected than the person who has 5. So that's as much as we know about these spike protein antibody levels.
This next question is related a little bit to the first that I had read off about new iterations of vaccine for the new variants. The main question here is, where do we go to learn about new iterations of vaccine and choose which one we want to put into our own body?
Okay, so new iterations. So there are 3 vaccines that are available in America. It's the Pfizer vaccine, Mrna Vaccine, which are the mRNA vaccines, and J&J, which is the viral vector vaccine. I spoke to you a little bit briefly. I didn't want to take up too much time, but if you want to learn more about those particular 3, I would recommend going to the CDC website and looking those up. They have very bulleted explanations, and then also detailed explanations if you really want to read up on the science behind it. So those are the 3. There aren't any new ones that I know of. Angelina, I don't know if you know of any other new ones that are out there.
Just the 3 have been approved. Yeah, in the United States, we only have 3 approved. Other countries have other kinds of vaccinations. Different countries have produced different ones, but in the United States, we only have the Pfizer, Moderna, which both work on the messenger RNA technology. And then we have the J&J, which is kind of the old vector technology where they take adenovirus, which is a very safe virus for the human body. And then they add this so that it goes in and produces the spike proteins. So those are the only 3 that is available in the United States. The answer is, which one is better? The one that protects you, or having a vaccine with antibodies in your body to being like, we actually look at antibodies such as, for example, once you have a fire, let's say you have a kitchen fire, if you take your fire extinguisher and then put it down quickly, it's gone. So that's what antibodies, the vaccination does. It provides another layer of defense in your body so that when the virus enters, it has enough to flush it down. Sometimes it's not able to put it out completely, but nevertheless, it's not going to burn the place down. So that is really what this is. So having any of these vaccines is definitely better than not having any. It's like not having any. And that's, it's just like the fire extinguisher analogy I told you about.
Right.
Thank
And
you.
just to clarify, the Moderna and the Pfizer vaccine are 2-dose vaccines, either 4 or 6 weeks apart, and the J&J is 1-dose vaccine. So if that makes a difference in you choosing which one you'd want, you can get a quicker, and you're considered fully vaccinated 2 weeks after your last dose. So if you wanted a quicker level of protection, the J&J, which is one dose, 2 weeks after that, you're protected. Pfizer is 6 weeks in between, and Moderna is 4 weeks in between. So if that helps you make a decision, that's there as well.
If we can still get COVID with the vaccine, why isn't certain meds like, I'm gonna probably not pronounce this correctly, ivermectin, pushed as hard as the vaccine? Is there medications out there that are as effective as the vaccine? Concern is long-term unknowns with the vaccine.
You want to you can take one part and then I'll talk about the monoclonal antibodies. So
Okay, fair enough, fair enough. So yes, there are medications that are out there that you can use to treat the actual virus. Many of them require inpatient stay, some do not require inpatient stay. But some of the other, and then you're probably saying, well, why are we not pushing these other medications as much as we are pushing the vaccine? So first, I'm not pushing anything. So I don't want you to think that I'm making you or forcing you or insisting that you do one thing or the other. But there's a lot more data with the vaccine. So we feel like there's so much, because so many people, like I said, over 300 million doses of the vaccine have been delivered, and we're able to monitor so many people. The treatment for COVID has not been, there's so many different drugs that people have used to try to treat COVID that not one has been studied long enough to actually, and in such high volume, to show the safety and the efficacy of those particular treatments. Like 365 million, I mean, monoclonal antibodies, which Angelina will talk about, not even close to 365 million doses were administered of that. So we can't push, and I'm not pushing anything, but I can't advocate any one particular treatment versus the other, but I can certainly advocate for vaccines because I know that they're safe, because we've given so many of them in a short period of time, and we've seen that there are no serious side effects in a large group of people.
if I may answer this, you get sick, okay, and let's say they go to the hospital. There are not enough hospital beds to really treat all these individuals. You all get sick to the point that, if you remember the spring and the first time, I mean, actually by the time Missouri was pretty better prepared than when it came into New York. You probably saw a lot of death in New York, especially nursing home. It's wiped out because there's just no hospital beds, no ventilator. Once the virus hits the body, you do not know how your body's going to react. Okay, I don't know. I'm a healthy individual, but until the virus enters my body, I do not know how my body's going to react. I may be okay, mild, and may go away, or it can really make me go into pneumonia and get short of breath. Now, two things. One thing is, even if you recover, and this is something I've had conversations with individuals who are unvaccinated, who got sick and were in the hospital, and then gave me and kind of called to find out how they're doing. And the important thing is to remember, it is like drowning. Not having oxygen to your lungs is like drowning, and to experience that for a period of 4 or 5 days, even by the time the doctors get all these medications in the body to fight it, it's like saving a drowned person, rather than teaching you to swim. It's easy to teach someone to swim and be safe about it, rather than every time throwing people into the river or making them drown and then saving them. That is the difference between protecting yourself versus actually saving individuals after they've gone that far. It's not an easy journey to go into, to be treated, and there is no medication that's 100%. If you had 100% medications for COVID, that once you turn COVID, we give it to you, people won't be dying. we won't be having this kind of death. But unfortunately, we do not have medications. There is ivermectin, but there's so much data. They all add a little bit for a little group of people that can make a difference. Okay, the vaccine is so much more, is 97%, is more than 90% better, or at least 80 to 90% better in preventing serious illness. Again, just because you turn positive with COVID means nothing. But we're talking about serious, going to the hospital, lying in a deathbed. That is the difference the vaccine makes. So there's no medication that can stop the progression once it enters the body. Now, saying that, there is a monoclonal antibody, which is basically the antibodies that a body would make once if I got positive. Like I said, I've had the vaccine goes in and makes all these antibodies to protect me. The same antibodies are generated in a lab, and they are then given to an individual who is tested positive. And if given within 5 days after they test positive, it has to begin very, very early on. Studies have found that the death rate has gone down in those individuals. And we are doing that for all our inpatients in our psychiatric hospitals and our state operated programs, that if any of our residents are turning or testing positive for COVID, we are giving monoclonal antibody infusion. Again, they have to be given as an infusion. So you have to take them out to a local infusion center. But the problem is many of these hospitals, infusion centers are so full that we have about another 3-day, 4-day waiting period. And by the time we get them in, it's already too late for this particular medicine to work. So they have to be given within 5 to 7 days. You cannot give it to them after they're hospitalized. It doesn't work. It actually makes it worse. So there's a very small window called Regen Covet, which can be given as an infusion. That is, it's kind of given through an intravenous infusion, and it has to be monitored for an hour after you have the infusion. But the places in the community are so full. So yes, that is something that can help you from getting sick if given early enough. But that is something even better that if you get vaccinated. So I just
let's
want
prevent from getting sick.
That prevents you
I
from
agree.
getting sick.
Prevention of getting illness versus flipping the coin and seeing whether or not I'm going to get so sick from this or not. To me, it's a no-brainer. Let's just try to protect ourselves as much as possible. And quite frankly, treatment. So COVID is coronavirus is a virus. So we, to date, have not had any successful treatments with any virus. Forget about COVID, but any virus to date. So cold, influenza, RSV, you name it. That's why the strategy for any major virus like smallpox that has caused such devastation, the strategy is to vaccinate. So we prevent getting that virus. See, viruses are unique in that they replicate really fast. All viruses tend to replicate very fast. And every time somebody replicates, there's small mutations that occur in that virus's DNA. When those viruses change, your body no longer can recognize that as foreign and now has to fight it off as if it was a new type of pathogen. So that's what makes viruses so deadly, is that they are infective, they are highly infective, and they mutate so fast that your bodies can't get used to it, and they can't fight them off. That's why every year there's a new flu vaccine, because the flu has mutated so much that we have to now inoculate more people. So everybody again. So again, historically speaking, we have not, as a scientific community, been successful in treating viruses, but we have been very, very successful in vaccinating against viruses. So that's the strategy here.
Sort of related to this, there's a question that says, does having COVID once before offer similar protection against severe symptoms the same way the vaccine does, or does getting the vaccine do something better for my body?
So we have seen, we have kept data in departmental health because we test, and we test not only our residents, but also staff on a regular basis and have a database. We are seeing a lot more reinfection with the Delta. We didn't see as much reinfection until about June, July. Since July, the reinfection rate has really gone up tremendously. the two things to remember here, what science has shown is that, yes, after you have COVID, your body can produce antibodies, and that antibodies do protect you for 90 days. There's no question about that. Everybody agrees on that. CDC, that's why they say don't test yourself again for 90 days if you have the COVID. It does protect you for 90 days. They've also done studies where they've taken how much antibodies are produced after a COVID infection versus how much antibodies are produced after a vaccination. And they found that the antibodies produced by the body after vaccination is several-fold higher than the antibodies produced by the COVID infection. Okay, so for 90 days, you're protected. After that, the protection is unknown. Whereas with vaccination, we know at least at this point for 6 months or longer, you have protection, but there is some data even that there may be a decline as time goes on, even with the current. And that's the reason why they started talking about the third dose, okay? So that's one thing. The second thing is also when you had the original variant COVID, that was very good at preventing yourself from getting the same strain again. But because the virus has mutated and now with the Delta, it has changed enough that the antibodies that your body produced in response to the first strain may or may not recognize Delta. Okay, and that is probably the reason why we are seeing a lot more reinfection the second time around now starting July. We are seeing a lot of reinfection in our staff, and we test our staff at least twice a week on a regular basis, all our staff. So we are seeing that reinfection. So, so definitely that is another thing. People who got sick the first time with COVID and had it really mild the first time, and they said, well, if this is all it is, I'll take it how many other times, no big deal. Second time around, they're much more sicker. It was not an easy, as I said, Delta is making people much more sicker than the original. So, you know, this is a gamble. This is where people are like, it was not bad at all the first time around. You know, I can take it, no big deal. So those are the things that make the vaccination much more valuable than going through COVID again.
Yeah, and one other thing that I wanted to point out, you brought this to my mind. We know that there are some long-term negative effects from a COVID infection. I know we talk about, I got a little cold, I was out for a few days, and now I'm back and I'm fine, and you know, I fought off the infection. Yeah, in the acute stage, sure, but there are these, you know, these other brain fog, long haul syndrome. There are all these other things that we're finding out that COVID infections are leading to longer term neurologic issues, not just the acute pulmonary thing. So if we can protect against that, I think we should, and I think the vaccine will help you fight it off early and hopefully prevent you from getting these long-term things. We don't have any data to show that, but in my opinion, you know, protect yourself first, so you don't have to run the risk of getting these severe long-term issues from COVID infection.
And on the topic of boosters, there's a couple of questions just about if we know how long after initial vaccination we must wait to receive the booster, when would be the best time to receive the booster, especially if you've already gotten both doses of vaccine and or had COVID and are immunocompromised. So there's kind of a lot in there, but do we have information about when is best to receive boosters?
Yes, the recommendation is 28 days after your last dose. So it's only recommended for mRNA vaccines, which is Pfizer and Moderna. So Pfizer, the first dose, and then the second dose is 3 weeks later. The third dose, if you're going to get, it has to be at least 28 days after the second dose. Moderna, first dose, 4 weeks later, second dose. And then again, 28 days later, you can get your third dose if needed. So anytime interval after 28 days is fine. So if you took both your vaccination in January, your second dose, and you're immunocompromised and you're eligible for a third dose, then you should be able to get it. And same thing after COVID. There's really no time limit after COVID when they should get it. Once you're out of that isolation, the 10-day isolation period after COVID, you should be able to get your vaccination. Several hospitals are offering the vaccination to individuals just before they're getting discharged after hospitalization as well. I hope that answered the question.
Yeah, that's a good point. I should have put that in as one of my myths because initially when the vaccine came out, people the recommendation was wait 3 months after you get COVID to get your vaccination. But that was only because there was such a limited supply. It wasn't any medical reason not to get the vaccine after your isolation, after you've recovered, your isolation period was over. So yeah, once you get the COVID virus, if you get the COVID virus and you've recovered, after your 10 to 20-day isolation period, depending if you're immunocompromised or not, you can get the vaccine immediately after that, and should.
I know we have just a few minutes left, so I want to try to keep us on time as best as I can. There's a question with regards, and I've actually heard this quite a bit as well. If there's any information on the newer variants we're hearing about now, Lambda, and I believe there's maybe even another one. Is it worse than Delta? Is there any information on what the vaccines might do against these newer variants?
So what I can confidently say is that I heard from Department of Health and Senior Services in a call this week, because as I said, we do regular sewer shared sequencing. That's how we know what is circulating in our sewer. Basically, the virus is present in your feces, even though it is not infective. And in the sewer, you can find out what kind of virus is still circulating around. And one of the things they found is they have not found Lambda. So that was a question. So they have not found Lambda. We do not know much about Lambda yet. It came out of Peru, and there is some discussion in the World Health Organization where they said it could be more contagious, it could be more infective, it may have some vaccine escape, meaning vaccines may not work. We do not have real life data yet in the United States. So at this point, at least if you live in Missouri, I don't think that's something we need to worry about currently. Okay. If it becomes an issue, definitely there'll be more information on it, and Department of Health and Senior Services will be acting on it very rapidly. But as of now, we do not have Lambda in Missouri.
What would be some medically valid reasons people shouldn't get the vaccine?
I mean, the only real contraindication is an allergic reaction to the vaccine. Other than that, you should certainly. I don't see any other medically valid reason not to get the vaccine. There may be certain unique things with you that you should talk to your doctor about if you've had Guillain-Barré in the past, and maybe consider a different type of protection. But honestly, the only recommended reason not to get it is if you had a severe allergic reaction to the vaccine or any of its components.
And any of the components. I mean, there are individuals who have stated that and the interesting thing is, for example, Pfizer has a little bit more different components. It's not the vaccine itself. It is the neutral things that they bind it with, the other stuff they put inside. So that material is what is actually people are allergic to. If that's the case, for example, Moderna uses a different kind of binding agents than Pfizer does, and J&J has even different kind of binding agents than the Moderna or the Pfizer. So if you do, so you can ask your doctor and say if you're allergic to something, and they can tell you if you're allergic to a particular binding agent, then they can offer a different vaccine type.
Does being an MRSA carrier risk complications with the virus and or vaccine?
No.
Nope.
A little bit along those lines, I suppose, is we have someone put in here that a family member of theirs had said that he is resistant to COVID-19 due to his blood type.
I wish that was true. Then we could have taken those individuals when we didn't have a lot of vaccines. I didn't have masks, when we were short of everything. We could have picked those individuals and say, you guys, the O group or whatever group, I forget what it is, that you guys are now going to be so protected. You can walk around when we needed essential workers, when we needed all those people who have superheroes who could defend against the virus. I wish that was true, but that is not true. Everybody.
I think there's a movie like that.
Yeah. Every single person is susceptible. It's so interesting that one of the people I work with very closely didn't want to get vaccinated because they said they're very young, they're very fit, they run marathon, they They eat healthy, they live a very healthy lifestyle, and they did not think they will get it because they thought if even they get it, they'll fight it. I got this phone call, and this particular lady was in her 50s. I got this phone call from the hospital and said, "Hey, doc, what should I do? I'm in the hospital. I can't breathe." And she was panicking. I can't breathe. I did not think I will get it. And this is the truth. We all think we are not going to get it. We all think we are healthy and we can beat it, you know, and hopefully we can beat it. But really, do I want to take the chance? Being without oxygen is not fun. And the worst thing is this particular person, of course, I'm very glad she recovered, but this particular person is going to take her at least 6 months to get back the energy to the level of functioning she was pre-COVID. That's the impact on the body. That's how much it takes out of the body to fight it, to survive, and after being in hospital for nearly a week. So kids, I know individuals who play game sports and or who are runners, and when they get the COVID, it takes them close to a year to get them back to run again. That's how much time it takes for recovery. Even it's not about death and living, it's impact on the on one's body. The same thing with people, for example, sports, kids who play sports, they're not been able to get on the basketball court for so long. At least one season they missed. So again, I don't want to go on off it. Let me answer your questions.
Yes, there's just one question left, and I think that's excellent timing. We are up on the hour, and that is, how long can a person continue to test positive for COVID after diagnosis or quarantine?
So what they've done is testing for COVID is two things. One is the PCR test is a very sensitive test, and people can test positive for COVID for a very long time. If you remember, when the first, the CDC recommended that you have to have two negatives tests taken 24 hours apart to be considered recovered. But what happened over a period of time is they started taking the specimens from those and tried to find if they can grow the virus from it. And they found that after day 10, they were not able to grow it. For more than 95% of the individuals, they were not able to grow it. And that's how they came up with a 10-day isolation period after COVID positive. So the recommendation currently by CDC is do not test after day 10. Okay, don't test. You test once for PCR as positive, don't test again. After, if your symptoms are better, you're not having a fever and you're functioning better, at day 11, you should be considered recovered, okay? The reason is because the PCR can pick up dead virus particles, and your body could still be shedding dead virus, but is not capable of infecting other individuals. It's not actively able to survive outside the, it's just not infective and transmissible, okay? So the recommendation by CDC is do not test for 90 days after you've had the COVID infection.
Thank you. Yep. So that I guess will conclude us. Go ahead.
I just have one thing I want to say. The reason that I'm very happy to talk to you group is I know individuals, the attendees in this group are caring for somebody with intellectual disability. And please, 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 they are very high risk. I'm going to share, I mean, it really broke my heart about last week when I saw my fourth client, community client who was placed in the community, 18-year-old, 32-year-old, 28-year-old, another 35-year-old, all unvaccinated and who had died of COVID. And they were not sick. I mean, these were otherwise reasonably healthy people. They may have had some obesity, they had had some hypertension, but if they had had the vaccine, they'd be alive today. And that is really the message I want to convey. We care for individuals with neurodevelopmental disorders, and neurodevelopmental disorders are very high risk for getting serious illness or dying. And this is the world data on it, and we've seen it. So please, 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 if you are caring for somebody or associated with the care of somebody with a neurodevelopmental disorder, please get them vaccinated. And the other thing is, if they do get sick within 5 days, if they test positive, don't wait for symptoms. If they test positive, take your exposure seriously. If a staff member walks in with positive, test the person. And if they test positive, please get a monoclonal antibody infusion. Call the primary care doctor and get them infusion. That will give them the chance of survival, but get them vaccinated. That is my plea. Thank you.
I second that.
Thank you, doctors.
She's
And
right.
thank you, everyone, for joining us. We were able to get to all of the questions, so that's great in the time that we had together today. But really just want to thank you all and enjoy the rest of your Tuesday. Thank you.
Thank you all. Bye.
Thanks, everybody. Bye-bye.